next skill we're going to demonstrate is occupied bed. So I'm going to clean my hands and gather my supplies. And I'm going to replace the top linen that is on the bed. If it is only a sheet on the bed, then I'll replace only the sheet. But Christy has both a sheet and a blanket, so I will replace both. So I'm going to need a fitted sheet, a flat sheet, a pillowcase. Do not get them against your uniform. Oops, and a blanket, because I'm going to replace the blanket. And I need a linen hamper for dirty linens. Good morning, Christy. My name is Becky. I'm your CNA, and we're going to change your bed, okay?
Okay.
Take me just a minute to get things set up here. So I'm going to move this to the side out of my way. I'm going to lock my bed brake. I'm going to put this side rail up because I'm going to roll her this way. I'm going to just raise the bed to a working height. Whoop! That's your head. It's on the outside. And I like my working height up high so I never bend my back. Okay. I'm going to pull my privacy curtain. Okay, I'll give this back to you in just a couple of minutes. I'm going to remove the blanket. And the reason I'm going to remove the blanket is so that it gets it out of my way. I'm going to untuck the top linen. Okay. I'm going to have you scooch over for me so that you're centered, at least centered in the bed, that way. Scoot that way for me, please. Okay. Now, 1, 2, 3, I'm going to roll you over away from me. Please don't scoot your butt out. Keeping her covered, I'm going to fix her head pillow so that's underneath her head. There we go, and she's comfortable. I'm going to undo the dirty bottom linen and turn it onto itself so it's going dirty to dirty. Just going to roll it up a couple of times. And I'm going to take my clean sheet. I'm going to lay it down. Make sure that the seams are on the inside. I'm going to attach at the top. I'm going to roll the clean part onto itself. Attach it at the bottom. Clean to clean. And push it right up next to the dirty one. Tuck this side in so that there's no wrinkles. Okay, I'm going to have you roll over towards me. There's going to be a big bump. All the way over we go. Keeping her covered, making sure I'm not wrapping her up like a sausage. I'm going to put this side rail up. Go over to the other side of the bed. Side rail down because we never work over a side rail. I'm going to start at the top remove the dirty sheet, dirty onto dirty, roll it onto itself, put it right in the hamper. At no time should your linen ever touch the floor. And her skin should never touch the mattress. Starting at the top, I'm going to pull the clean sheet over and tuck it. Pulling all the wrinkles out as I go. Pull it nice and tight, making sure there's no wrinkles. Okay, I'm going to have to roll over on your back, please. Put the side rail down. I'm going to take the clean top sheet. I'm going to lay it down and unfold it. We never shake our linens. And this was folded weird. I'm not going to worry about getting it centered right now because when I pull the dirty sheet out, it'll just screw it up anyway. So I'm just going to lay it out. Could you hold this for me, please?
Mm-hmm.
And I'm going to reach underneath and pull the dirty sheet out from underneath the clean one. And place it in the hamper. And I'm going to straighten this sheet out. I'm going to use, if the sheets have been folded correctly, there should be a center line on the sheet so that I can get it centered on the bed. There it is. It needs to come over this way just a bit. We never want the top sheet to show on the side of the bed where the door is, because it looks nasty. I'm going to take my blanket, lay it on top of the sheet. And it's folded wacky-do. Remember, no shaking the linens. Okay. So I'm going to put it up just about this high so that I can fold that sheet over. Make sure that it's centered on the bed and it's sideways. Make sure the sheet on this side is completely covered. While I'm up here, I'm going to fold the top sheet back. Then I'm going to miter my corners, which means I'm going to reach underneath, lift the mattress, sweep it towards the head of the bed. Then I'm going to make a triangle about a foot away from the end, tuck, and let it fall. I'm going to do the same thing on this side. Pull it nice and snug. Make my triangle, tuck, and let it fall. Now, I don't want her to get pressure ulcers on her heels, so I'm going to grab a hold, pull the blanket and top sheet down. Can you wiggle your feet for me, please? Good. I'm going to change her pillowcase. So I'm going to gently raise her head, remove the pillow, lower the head, remove the dirty pillowcase. Put it in my hamper. I'm going to gather up the clean pillowcase like a sock. Your stomach's growling, you need lunch. Just roll it up this way until I get to the bottom. Then I'm going to turn it sideways on the bed, open it up so that I can see that bottom seam. Fold this pillow in half this way, slide it in. Let it open so that I can get it into the corners. Grab a hold of the outside, pull it down. Now you can either make an envelope to close it. I think it takes too much time, so all I do is fold it over. Gently lift her head. Put the pillow underneath, head and neck only. I'm going to lower the bed. Okay, Christy, here's your call light. Put it right in her hand. Put her water. Can you reach it?
I can.
I'm going to open my curtain. Remove my linens. And clean my hands with alcohol hand hygiene. Go to the quiet area. Have a seat until the next skill is ready. Okay, the next skill that we are going to demonstrate will be mouth care, and that is brushing teeth with someone sitting in a chair. So Christy will clean her hands, grab a pair of gloves, and gather her supplies, which includes a towel, a washcloth, an emesis basin, and toothpaste, and a cup, and a towel and a washcloth. That hamper. Anytime you have linens, you have to have some place to put them.
Okay,
And
so
yeah.
you're doing.
Yes.
Good morning, Becky. I'm Christy, your CNA, and we're going to be brushing your teeth this morning.
Okay, great.
Okay, so put down my supplies here. And just going to cover you up a little bit so we don't get anything on you. Okay.
She's going to provide privacy by pulling the curtain
Right.
before she gets started.
Okay. And I would have water in the cup.
Uh-huh.
Okay. And do you want to rinse your mouth
Yes.
first?
Whoops. I'm going to put this way
Okay.
so it doesn't fall off of my hooties.
Toothpaste. Okay. And now I'm brushing the outer surface.
Teeth and
And the
gums.
teeth and the gums and the sides. And then we'll be doing inside and the palate and the tongue. And there's spit. And that back up there.
Rinse.
And right. I'm gonna let you rinse and spit. Okay. And,
You want to make sure that you verbalize, yes, and Christy did great. You want to make sure that you verbalize all the surfaces that you brush. So you want to say, I'm going to brush the outer teeth and gums, top and bottom, front teeth and gums, top and bottom, outer on the right, top and bottom, spit, inner, upper surfaces on the inside, teeth and gums, on the left side, teeth and gums, right behind the front teeth. Do the same thing on the bottom. You also want to say that you're cleaning the chewing surfaces, because if you look in your Bible, it says all surfaces. So now that I've rinsed, she's finished brushing my teeth, and I moved the towel, and I'm a bad person.
so take that.
Perfect, thank you.
Okay, that in the hamper. And go clean this. And this.
If it's a disposable cup, you can empty it and put it in the trash. If it is not, then you'll empty it and put it back at the bedside.
Okay. Okay, well, there's no paper towels, so let's grab this one. Drying it, even though there's really no paper towel in there.
Oh, I'll have to look.
Okay. And rinse the toothbrush. Dry it. Put the toothpaste back in here. Okay, that. Should I put that away first?
Yeah, that's fine.
Okay. Put this back where we got it. Okay, this in the hamper. Make sure you have your coal light. Can you reach your water?
Yes, I can, thank you.
Okay.
And the curtain.
Right, the curtain open again. And
She'll remove her gloves and perform hand hygiene. And go to the quiet area and wait for the next skill. Okay, the next skill that we're going to demonstrate is female perineal care. And it is also with hand washing. So once you complete the skill, you will wash your hands with soap and water as previously demonstrated. So Christy's going to clean her hands, gather her supplies, and she's going to need...
right, well, let me hand hygiene. Okay. Last towel.
She's going to get 2 towels, 3 washcloths, a bath blanket, and a barrier like it chucks, so that it protects the linens. On the bottom? Is there one on the bottom? If not, there'll be one in the drawer.
Yeah, let's see, is that a Chuck's?
Yep.
Okay.
Bath blanket, 2 towels, 3 washcloths,
Washcloths, yeah, we're good.
and the chucks.
And the basin up.
And it'll be in the bedside. At boards, all of your supplies will be laid out on a long table, so they're real easy to gather. You won't have to go into bedside stands or linen closets. So she's going to begin.
Good morning, Deborah. I'm Christy, your CNA, And we're going to be doing some perineal care on you, getting you all cleaned up. So just give me a minute to get situated. So, that, and out.
And yeah, she'll need the bath basin and she'll need soap. But for perineal care, we do not need lotion. And she's going to set up her workstation first.
I'm going to lock the bed breaks and I'm closing the curtain. Okay. Okay, now I'm going to go get my water.
If she had raised the bed to a working height before she got her water, she would have to put the bed back down because we never leave the bedside with the bed in a high position. So she's tested the water. She's now going to have Deborah
Feels
test
good.
it.
Deborah, how's that feel?
Perfect.
Good. Okay. Okay. And now I'm going to.
She'll raise, whoop, wrong one hand, that's the knees.
Oh, yeah.
So one in the middle. You might want to put the knees down. And this bed didn't eat its Wheaties, so it's a little slow.
Yes, it is. All right. That's how it goes. Okay.
And now she will put her gloves on before she begins.
Okay.
And there is no side rail on this bed, so she's going to have to ask the proctor, and I will act as the proctor, to stand on the side of the bed.
Okay. So,
That's fine.
okay.
You can either put the bath blanket on first, or you can put the chuck on first. It doesn't matter.
Okay. So, I'm going to.
Roll her over.
Okay, Deborah, I'm just going to roll you over onto your side for a moment.
And she's going to put the chucks down so that the waterproof side is down. Turn it around. Turn it around the other way. There we go. And she's only going to put it underneath far enough to protect her linens. It does not have to be pulled all the way through because she's going to remove it once she has completed the perineal care.
Okay.
Now she's going to place the bath blanket over the top of her. The bath blanket provides warmth and also privacy. And the reason that we use the bath blanket is so that we don't take the chance on getting the linens wet. Because if you get the linens wet, then you have to change them. So she'll now reach underneath the bath blanket and pull those top linens down to the foot of the bed.
Still keeping her covered.
Yep, still maintaining her dignity and her privacy by keeping her covered. Excellent.
Okay. Okay. And put this here for now.
Now what she's going to do is she's going to expose the part of the body that she's working on. She's going to push the gown up onto the tummy so it's out of the way and underneath the bath blanket so it only exposed that part that she's working on. And you can either place the towel as a drape down here or up here, it doesn't matter. The drape is not absolutely necessary. I just feel that it gives them a more sense of the privacy. So now she's ready to begin the process.
Okay.
So she's going to wring out a rag, add a little bit of soap to it.
Okay, and then
she's going to open the labia, and she's going to tell her what she's doing, because nobody wants somebody's hands down there pulling and stretching on stuff.
So I'm opening up your labia so I can
Yes.
get near the urinary meatus.
And she's going to start with the urinary meatus. 1 stroke. Turn the cloth, inner labia.
Inner labia.
Turn the cloth, inner labia on the other side. Turn the cloth, outer labia. Turn the cloth, outer labia on the other side. Turn the cloth, and do the vagina. Then that cloth can go in the hamper, because you're done with that. Now she's going to rinse in the same manner with clear water. And remember, we do not put water in the, put soap in the water.
Right.
So she's going to say, I'm going to open the labia back up again so I can rinse. Urinary meatus.
Yep.
Stroke down. Turn the cloth, inner labia on one side. Turn the cloth, inner labia on the other side. Turn the cloth, outer labia on one side. Turn the cloth, outer labia on the other side. Turn the cloth and the vagina. 1 stroke. And then that goes back into the pan because it is your rinse cloth.
Right.
Now she's going to dry in the same manner in which she washed and rinsed. Pat, pat, pat to make sure it's get all the moisture out of it.
Okay.
Now she's going to cover her back up, roll her over, and your drape you can put right down on the chucks alongside of her. Roll her over so that we can clean from vagina to anus, and we're going to keep her covered as much as possible and only expose that part of her that we're actually going to clean. Clean washcloth, brand new clean washcloth. She moistens it, adds a little soap, strokes from vagina to anus, turns the cloth. 1 more time, stroke vagina to anus. That cloth is ready to go in the hamper, and we're going to rinse in the same manner. Turn the cloth, vagina to anus, pat dry. And that towel is done also. She's going to cover her up and remove the checks and put it in the trash. She's ready to be rolled back over, positioned in the center of the bed. And she will pull the top linens back up and put them into place. And roll the bath blanket off. Place it in the hamper. Now she can straighten her up. Give her a call light.
There we go. I'm going to give you your call light and your water, and I'm going to lower the bed again.
Yes. Because we never walk away leaving a bed in a high position, and she has to clean her tub, dry it, and put it away. Now you can either open the curtain now, or you can open the curtain and make sure she has a call light in the water after you empty the basin. It doesn't really matter, as long as before you complete the task that you do make sure she has her water and her call light.
Okay, and there's your call light and your water here. You can reach it. Good. Okay. This will stay. And
Beautiful.
hamper, and then in the curtain.
And we empty this into the toilet or the
Right.
commode because it is below the waist.
Rinse. Do it again. Dry it. I am putting it on the towel or something.
And remove her gloves.
Okay.
And she can put the basin away. Then come back and wash your hands with soap and water using correct hand washing technique. That is part of this skill.
Okay. And you come back and do the hand
Hand
washing.
washing. And remove the lines.
Right.
Perfect. And once your hand washing is complete, she'll go to the quiet area, have a seat, and wait for the next skill. Okay, we're going to do a pivot transfer from bed to wheelchair on a patient who can stand but cannot ambulate. Good morning, Christy. My name's Becky. I'm your CNA, and it's time to get you up in a wheelchair, okay?
Okay.
It's going to take me a couple of minutes.
Okay.
I'm going to clean my hands. I'm going to lock my bed brakes. I'm going to put my wheelchair at the foot of the bed. Put it right here. I'm going to close my curtain. The wheelchair was in the room, by the way. If it was out of the room, I would have brought it in with me when I came. I'm going to put the bed in the lowest position to make sure we can get your feet flat on the floor. Okay. I need gait belt and socks. And I'm going to put them right here in my wheelchair so I don't forget them. Okay, I'm going to raise the head of the bed up so that you're in a, whoops, wrong button. So you're in a sitting position, so it's not quite so hard to get up and out. Let me know if you feel any discomfort at all. It's over here. Up we go. You okay?
Oh, you're good.
And then we're going to come all the way up. That's as high as she goes. Okay. I'm going to put your socks on. These are so you don't slip.
Oh, okay.
Okay. Now I'm going to have you sit forward for me. I'm going to put my arm behind your shoulders and one under your knees. This pillow keeps falling, so I'm going to put it down here. And I'm going to put your hands on the bed, please, so you can assist yourself. I'm going to count to 3. When I say swing, I need you to swing your legs off the side of the bed. 1, 2, 3, swing. Good. You all right?
I'm good.
Okay, come forward for me so your feet are flat on the floor. Perfect. I'm going to move my wheelchair up so that it's right next to you and it's touching the bed, and lock the wheels. Okay, I'm going to put this belt on you. It goes around your waist so that it gives me something to hold on to. And we always put gait belts over clothing. We never put them on bare skin. Pull it up nice and snug against my hand. Through the second buckle. And pull it tight. And it needs to be just 1 finger breadth. Okay. Now, I'm going to have you open your legs just a little bit. And I'm going to move this foot forward just a bit. Okay? I'm going to put my leg right here to keep you nice and stable. I'm going to count to 3. And when I say stand, I want you to stand, turn, sit in the wheelchair, okay? 1, 2, 3, stand. And sit. Perfect. Now I'm going to have you scooch back for me. Good. Let's get this old belt off. Okay, but lean forward for me, please. Don't want to scrape your skin. Get the gate belt away where I found it. Leave the socks on, because she's no bare feet on bare floor. Unlock the wheelchair so it doesn't become a restraint. Here's your water. Can you reach it?
I can.
Here's your call light. Put it right in your hand. Okay, do you need anything else?
No, that's good.
Okay, I'm going to open the curtain. And I'm going to clean my hands. Okay, you need anything, just put your light on. Otherwise, I'll check on you in a little bit, okay?
Okay, thank you.
Okay, I'm going to transfer patient from the wheelchair into the bed. She can stand, bear weight, but cannot ambulate. So I'm going to knock, knock, knock. Good morning, Christy. I'm Becky. I'm your CNA.
Okay.
I hear you're ready to get back to bed.
I am.
Okay, it's going to take me a minute to get everything set up.
Okay.
I'm going to clean my hands. I'm going to move this out of the way. I'm going to lock my bed. I'm going to close the curtain, offer privacy. Okay. Now, I'm going to put the head of the bed flat so that we can get you positioned into bed correctly and not have to wiggle around a lot.
Okay.
The bed's slower than me. Almost there. Okay. Okay. Now I'm going to pull you up here a ways, and I'm going to put the wheelchair right next to the bed. And that bed's up too high, so I'm going to lower it down and make sure that it's at the same height as the wheelchair. That's as low as it goes. Okay, I'm going to lock the brakes. Bed brakes are already locked, but I do need to lock the wheelchair brakes. Okay, I'm going to have you lean forward for me, please. I'm going to put this gate belt on you so that I have something to hang on to when you transfer, okay? Pull it up nice and snug. Put it in the second part of the buckle. Are you hungry?
Yeah, I forgot.
I guess so. Okay. What I'm going to have you do is scoot forward for me, please. Put your feet flat on the floor. I want you to put your hands on the armrests to help push it up. I need you to open your legs a little bit. I'm going to put this foot forward just a little bit. I'm going to put my feet right here to help stabilize your legs. I'm going to count to 3, and when I say stand, I want you to stand, turn, sit on the bed. Okay? 1, 2, 3. Stand and sit. You okay?
Mm-hmm.
Okay, scoot back for me, please. Good. I'm going to take your belt off. Okay. Gonna unlock the wheelchair and move it out of my way. Okay. I want you to go down on this elbow for me. I'm gonna put my arm behind your shoulders and under your knees. I'm gonna say 1, 2, 3, swing, and I want you to swing your legs onto the bed. 1, 2, 3, swing. Good. Down you go. Fix your head pillow. Just make sure you're straight in the bed. Yeah, scooch over this way just a little bit. Good. Gonna remove these socks because they've been on the floor. You don't need them in the bed. Okay. Put them away. You comfy?
I am.
Okay. Here's your water. Can you reach it?
Yes, I can.
Here's your call light. If you need anything, let me know, okay? Gonna put the wheelchair out of the way. Open my curtain. Clean my hands. Okay, let me know if you need anything else.
Okay, thank you.
And go to the quiet area. So, good morning, Christy. My name's Becky. I'm your CNA. We're
Okay.
gonna do some exercises on your right leg,
Oh,
okay? On your right hip and knee. So I'm gonna clean my hands. I'm gonna just move this out of the way. It's gonna take me a minute or two here. I'm going to lock my bed break. I'm going to close my privacy curtain. Okay, I'm gonna get the bed up. I'm gonna have you roll over on your back for me, please. Make sure you're centered in the bed. Atta girl. Okay. And I'm gonna put the bed up into working height so they don't break my back. Okay. And I need to put your head flat. You let me know if it's uncomfortable. Because we can't get full range of motion if your head is elevated. So, I'm gonna start with your hip, and I'm gonna do flexion and extension. So it's a little like being in the Rockettes.
Oh.
I'm gonna support your knee, just relax, and your ankle. And we're gonna go all the way up, and you let me know if it's uncomfortable at all.
Okay.
Okay, here we go. 1. Doesn't hurt at all, does it?
Nope.
2, and all the way back down. 1 more. Good. Okay, now we're gonna do snow angel, and that is adduction of the hip. So I'm gonna bring it all the way out this way towards me. And you let me know if it hurts.
Okay.
You okay?
Mhm.
Oh my goodness, you're flexible. Keeping my hands under the knee and the ankle. 1 more, 2. Okay. Doesn't hurt, does it?
Nope.
1 more, and that's 3. Okay. And now we're going to abduct the hip. So we're going to cross over. 1. Doesn't hurt, does it? 2. 3. You okay?
Mm-hmm.
Now we're going to do flexion and extension of the hip. And what that is I'm going to flex your knee. So we're going to bend your knee all the way up. You ready?
Mm-hmm.
1, 2. Does that hurt at all?
No, feels good.
3. All done. How's that feel?
Very good.
Here's your call light. I'm going to put your bed down. Okay. Here's your water. Can you reach it?
Yes, I can.
Okay. Do you need anything else before I go?
No, that's it. Thanks.
Okay. I'm going to open the curtain. I'm going to clean my hands with alcohol. Okay, if you need anything, just put your light on,
Okay,
okay?
thank you.
And go to the quiet area. Okay, now we're going to do range of motion of the right shoulder. And at boards, the proctor will read you a scenario that tells you left or right. So I'm going to knock on the door. Good morning, Christy. My name's Becky. I'm your CNA today. And we're
Okay.
going to do some shoulder exercises, okay?
Okay.
Okay, it's going to take me a minute to get everything set up here. I'm going to clean my hands. Okay, can I get you to roll over on your back? You need some help?
No, I'm good.
Okay, scooch so that you're centered in the bed. Good. I'm going to put your crawl light over here. I'm going to step on make sure my bed is locked. I'm going to pull my curtain. Okay, I'm going to put your bed up in a high position so I don't hurt myself, okay? So up we go. You okay?
Yep, I'm good.
Sometimes if I'm laying on a bed and it goes up like this, it makes me a little lightheaded.
Oh, okay.
Okay, I need to put your head flat, okay, so we can get full range of motion of that shoulder. Okay. And we're doing the right shoulder, so it's going to be this arm. I'm going to make sure that your palm up. I'm going to support the wrist and the elbow. The first thing we're going to do is flexion and extension, which means we're going to take your arm all the way up above your head.
Okay.
Okay, you ready?
Mm-hmm.
All the way. 1, let me know if it hurts. 2, you okay?
Mm-hmm.
1 more. 3. Okay. Now we're going to do snow angels. So I'm going to switch my hands and we're going to go all the way up to your head. And what that does is that adducts your shoulder,
Okay.
forces it in.
Okay.
So here we go. Let me know if it hurts. All the way up and all the way back. No pain?
No.
2, 1 more. And 3. And back to center line. Okay, now we're going to abduct the shoulder. So we're going to bring your arm all the way across your chest. Again, I'm going to support your elbow and your wrist. And here we go. Let me know if it hurts. 1, 2, doesn't hurt, does it?
No.
Good. 1 more. 3, good. How's that feel?
Oh, good.
All done?
Oh, great.
So here's your call light. I'm going to put your bed down. How was bingo today?
Oh, it was wonderful. I won.
Did you win the cruise?
I did. I won with the full card.
All right. Good
Yeah.
for you. Good, good. I never win at bingo. Here's your water. Can you reach it?
I can.
Okay. I'm going to open my curtain. I'm going to clean my hands. Rub them till they're dry. If you need anything, just put your light on, okay?
Okay, I will. Thank you.
Exit the room and go to the quiet area. Okay. One of the testable skills is positioning someone on their side, which is a lateral positioning. So I'm gonna clean my hands and I'm gonna get my pillows, and I need 3 pillows. And I'm gonna make sure I do not touch them to my uniform. Good morning, Christy. My name's Becky. I'm your CNA, and we need to put you over on your left side, okay?
Okay.
At boards, the proctor will give you a scenario that tells you which side you will put them on. If you put them on the incorrect side, it is an automatic fail. So you need to know your right from your left. So I'm going to put her on her left side, which is over there. So I'm going to lock my bed break. I'm going to come around here. And I'm going to put the side rail up on this side because I'm going to be turning her in this direction. And this will prevent me from rolling her out of bed if I get too over enthusiastic. So I'm going to put the bed in a high position. And because it's on the outside of the side rail, I put the side rail up, I do not have to squat. I'm going to close my curtain. And then I'm going to put her arms. Now she cannot turn on her own, otherwise we would not have to position her. So I'm going to put her arms across her chest. I'm going to explain to her what I'm going to do. I'm going to move you over towards me so that when I turn you, your face won't be in the side rail, okay?
Okay.
So I'm going to put my arm underneath her shoulders here and underneath her shoulders here. Bend my knees and pull her over using my legs so that her shoulder is in the middle of the bed. Now raise your head, fix your head pillow so you're comfy. Just above the butt, and I apologize, my hands are stiff. Just below, bend my legs and pull her over. Ankles, knees, make sure she's in a straight line. So you're going to pull them over in 3 sections. Then I'm going to take this arm, fold it this way. I'm going to cross this leg across that one. Okay, put my hand on her hip, on her shoulder, bend my knees, straighten my legs, and she'll roll right over. Now I'm going to put a pillow along her back to support her on her side. It goes from shoulder to the waist. I'm going to lay it flat, tuck the leading edge in, then roll it under, like this. And I'm going to roll her back on it, and it forms a wedge, and it locks it right in place. Then I'm going to fix her head pillow. Head pillow should go under the head and neck only, so that it creates kind of a little nest. Supports the cervical spine and creates a little nest for the head. Okay? Now I'm going to place a pillow between her knees and her ankles. I'm going to straighten this bottom leg a little bit. Bend the top leg so that it's not resting on top of the other foot. And I always put the opening away from the face. To raise her arm, to put the pillow underneath, I go underneath. CNAs do not have fingers, CNAs have flippers. This pillow supports the shoulder and the forearm. Now I'm going to go around to the other side. Put my side rail down because we never work across the side rail. Then I'm going to roll her shoulder out because we do not want to position anybody on a bony prominence, like this bony spot on the shoulder or the trochanter of the hip, which is the part of the femur that sticks out. So I'm going to make a tray of my hands. I'm gonna go from the top, underneath her shoulder, from the bottom, underneath her shoulder, put my hands together like a tray, and then I'm just gonna roll the shoulder up towards the ceiling. I am not gonna pull it towards me. So I'm just gonna roll it up. So that puts that shoulder in a nice straight line so that we're not putting any pressure on that bone. Then I'm gonna put my hands together like a tray, go underneath her hip, all the way under. I'm sorry, I've got a thumb that doesn't want to straighten out. There we go. Make that tray again. I've got her hip right in the palms of my hands. Then I'm gonna just roll it up a little bit so that she's laying here on the fat of the land and not on this bone. How's that feel?
Oh, it feels wonderful.
Okay. Whoa, just threw the call light on the floor. Okay, I'm gonna put the bed down. Oh, that sun is shining in my eyes. When we're doing side positioning, we need to make sure they're centered in the bed and that they're not hanging off one side or another. I'm gonna put the call light right in her hand, and I moved her water over here where she can reach it. Can you reach your water? Okay. I'm gonna open my curtain, take one last look. She looks nice and straight. I'm gonna clean my hands. Okay, if you need anything, just put your light on her. I'll be back in a little while, okay?
Okay, thank you.
And we're done. Okay, the next skill I'm going to demonstrate is dressing someone with an affected side. So according to the scenario that the cameraman gave me, she is paralyzed on the left side. So I'm going to clean my hands. Even though I just cleaned them, I'm cleaning them again because this is a brand new skill, new patient, new room. So I'm going to clean my hands, rub them until they're dry. I'm going to gather what I'm going to need, which will include a pair of socks, a shirt, and pants. Now, I have a short sleeve shirt. At Boards it will be I believe a long sleeve shirt. So, I need a linen basket. I'm going to knock on the door. Good morning, Christy. My name's Becky. I'm your CNA today. And it's time to get you dressed.
Okay.
Okay? Got a pretty pair of pants and shoes, shirts, and
Nice.
stuff. So it'll take me just a minute to get things ready. So I'm going to step on, make sure my bread is locked. I'm going to close my curtain. I'm going to put the bed in a high working position. And we need to make sure when we're dressing and undressing that we do not expose them. Even though the curtain is closed, the door is closed, we still must maintain their dignity. Now, her left side is paralyzed. So we need to remove her gown from the strong side. So I'm going to raise the head of your bed, Christy. Makes it easier to put your shirt on, okay? And I'm going to bring it all the way up. Let me know if you feel any discomfort at all, okay? All the way up. You okay?
Yep.
Almost there. This bed's almost got rhythm, doesn't it? Okay. So I'm going to put this side rail down because we never work across the side rail. I'm just going to reach behind you and untie your gown. Now, we always remove it from the strong side. So I'm going to have you pull your arm out for me. Good. Keeping her covered. Now, she's paralyzed on the other side. So what I'm going to do is take this over to the other side because that's where I'm going to start dressing her. So I'm just going to ease this gown. If I don't pull your hair out, ease this gown. I'm going to reach down, support the paralyzed arm, pull it out, and still continue to keep her covered. So I'm going to take, and we always dress the affected side first. So I'm going to gather up the sleeve. I'm going to reach inside and support the paralyzed arm while I pull the shirt up over her affected arm. And have you lean forward for me. Pull the shirt around behind her this way. I'm going to have her put her good arm, forward we go. Put your arm in here for me, please. And button the shirt up. Now, I'm not going to take the time to button it because with these hands and my tremor, we could be here till a week from Wednesday. Okay? Now I'm going to put her head back down. I'm going to put her head back down so that I can start her pants. You cannot put pants on somebody when the head is elevated because you can't get their bottom up in the air to get them pulled up. Fingernails. Down we go. You okay?
Mm-hmm.
I'm going to loosen the linens at the foot. I'm going to untuck them so I can get to her feet and legs. Now, it does not matter if you put the socks on and then the pants, or you put the pants and then the socks. Doesn't make a difference. What does make a difference is that you started on the affected side first. So I'm going to gather up the left pant leg. I'm going to reach inside, take a hold of the affected foot, lift it up, and pull the pant leg onto that affected foot. Then I'm going to gather this side up. Okay. And pull it up. Now I'm going to work the pants up the legs. And I can do them both at the same time. Once they're started, it doesn't really matter. As long as you support that affected side. Notice I'm keeping her covered, pulling it up underneath her. I'm going to now get rid of this gown. Get it out from underneath you. Pull it out just like I did the sheet for the occupied bed. Put it in the hamper. Need that out of there. Okay. Now, I'm going to reach underneath, roll her towards me, and I'm going to pull the pants up over her bottom. Okay. Roll her back over. And I'm going to go over to the other side of the bed. And I'm going to roll her towards me. I'm going to take this arm, put it across her chest. I'm going to roll her towards me. Pull the pants up as soon as I find them. I'm going to get rid of this blanket because she's covered. Straighten her shirt. Back over we go. Make sure the pants are on straight, that the shirt is on straight, nice and neat. And these pants are about 55 sizes too big for you. I'm going to get these linens out of the way. Straighten the pant legs. Put on the socks. And to put on socks, you gather them up. Put them on the toe first. Lift the foot up in the air. Slide it over the heel. Straighten it up. Make sure it's nice and neat with no wrinkles. Same thing with the other foot. Go. Okay. Make sure she's nice and neat. Bring this side table back over to the other side because she's paralyzed on the left, so I can't put her water on the paralyzed side. Bring her over here. Lower the bed. Pull my eyebrows off. I'm going to put the collar right in her little hand. Put the side overbed table next to her with her water. Can you reach it?
I can.
I'm going to open the curtain. At boards, the hand cleaner will be at the bedside, so I'll clean my hands. Rub them till they're dry. Take the linen out. It's heavy. And go to the quiet area and wait until we're ready for the next skill.